Thank you all for coming. My name is Chris Scoble from Citizen Action. I'm the healthcare organizer with Citizen Action. Citizen Action is a grassroots membership organization fighting for racial, social, and economic justice. Recently, we won fair share tax reform and have been one of the only groups that was protesting the state Senate coup. Right now, we're working to achieve quality for affordable healthcare for all as part of Healthcare for America Now. Healthcare for America Now is a coalition of over 1,000 grassroots organizations spread all over the country, fighting for quality, affordable healthcare, supporting healthcare reform that is equitable, affordable, and available to all, and through a plan that will serve as an alternative to the private health insurance companies. We chose to hold this press conference in front of Scott Murphy's office today because we want to applaud him for continuing to support a public option and ask him to support the public option as well as the other provisions that are in HR 3200, the current House bill. We agree with Congressman Murphy that the public option is the best bet to compete with the private insurance companies and to keep healthcare premiums down, and that will ensure more Americans will be covered. So today we're also here to release two reports, one on affordability and the issue that the lack of affordability is posing for individuals, families, and small businesses. And then we're also going to be talking about how to pay for health care. And we're releasing a report on that. So first we'll have Al Ormsby speak on the affordability report.
Hello. My name is Al Ormsby, and I'm a member of the Saratoga County Democratic Committee and a board member of Citizen Action in the Capital District. We're here today because we want quality health care at a price we all can afford, and we want it now. Soaring health care costs are crushing individuals, families, and businesses. What good is it to have the best medical care in the world if it's unaffordable? We need health care that we can afford. And that's exactly what President Obama's plan does. It will rein in costs while keeping the insurance companies honest. And it offers us the widest range of choices, which includes, in addition to private plans, a public health insurance option. If you select the private plan, that's okay. And for those people down there, they have the freedom to select any plan they want. But if you don't want to be insured by a corporate entity that bases its decisions about your family's health care on their investors' profit margins, there will be a plan for you too. And that is what having real choice means. Healthcare for America Now's report on affordability irrefutably documents that both healthcare and health insurance are becoming increasingly unaffordable for an ever-expanding portion of Americans. The facts say it all. In the past 9 years, health insurance premiums have gone up 4 times faster than wages. Between 2000 and 2007, healthcare premiums have risen 18%, while individual income has only increased 11%. Families are forced to choose between healthcare coverage and other necessities, and even with that terrible choice, 1 in 5 families will struggle to pay medical bills. In 2008, 62% of bankruptcies were directly related to medical indebtedness, and 75% of those filers had private or so-called health insurance. Our current healthcare system is driving individuals, families, and businesses into financial ruin. Skyrocketing costs coupled with today's high rate of unemployment is a death sentence for many people. Between 2000 and 2006, it's estimated that 137,000 people died due to lack of health insurance. No matter how hard we work, we just can't keep up. That's not sustainable, and that's not right. If we don't pass genuine reform, we won't be able to keep or afford the insurance we have now. Bills will pile up, medical bankruptcies will increase, and businesses will shut their doors. And we'll never be able to insure the nearly 50 million people in this country who have no health insurance at all. If we are to stop the financial bleeding due to uncontrolled healthcare costs, we must pass a bill that represents true reform this year. That's why we're asking Congressman Murphy to vote yes on the House Bill H.R. 3200 and its measures to equitably increase affordability. Now, Mike Carmel from the Communication Workers of America will discuss a report that details options for paying for the health care reform that is absolutely necessary. Mike?
Thank you, Al. My name is Mike Carmel, and I'm from the Communications Workers of America. We're a coalition member of HCAN, and I want to talk about funding the public health system. We must pass quality, affordable health care for all, including a public insurance option. Numerous polls show that Americans demand no less. We must also pay for health care reform, education, clean energy, infrastructure, and programs to alleviate hardship and expand opportunity. President Obama in June identified savings proposal in the healthcare system that would yield $313 billion over the next 10 years. Earlier this year, President Obama proposed a $309 billion in savings for a total of $622 billion in savings over the next 10 years. These proposed savings are just a start, but it's not possible to fully fund healthcare reform and provide quality, affordable healthcare for all while relying on savings alone. This will require revenue beyond $622 billion. Affordability must be the cornerstone of a healthcare reform, and we must not force Americans who are already struggling to pay their healthcare costs and other bills to shoulder a disproportionate share of the cost of the reform. The wealthiest Americans must pay their fair share. There are a number of responsible, fair options for raising the revenue we need to fund the healthcare system we deserve and other critical priorities. For example, applying a surcharge to income above $280,000 for individuals and $350,000 for families. A surcharge is a flat tax rate applied to the adjusted gross income. This measure would only affect 1.2% of taxpayers and would raise more than $500 billion over the next 10 years with no effect on the poor and middle class. Limiting itemized deductions for wealthiest taxpayers. Itemized deductions currently subsidize certain activities at much higher rates for wealthy people than for middle-income people, and that's not fair. The President's proposal to limit itemized deductions would reduce this unfairness and raise more than $260 billion over the next decade. Revising the Medicare tax so that it applies to investment income. Right now, the Medicare tax applies only to income from work. People who make their money from investments do not share in that cost. Expanding the Medicare tax to apply to investment income would raise more than $40 billion a year, even after exempting $50,000 to $100,000 in investment income for retirees. Eliminating loopholes that encourage corporations to shift profits and jobs overseas to avoid U.S. taxes. Many of these schemes involve investments and transactions that only exist on paper and are used to make profits appear to be foreign profits, so they won't be taxed. The President's proposal to end these schemes can raise $150 to $200 billion over the next decade. We asked Congressman Murphy to support Bill H.R. 3200 and its surcharges that applies. Through the support of this bill and the surcharge, we can avoid burdening those who have already feel the pains of a tough economy and sky-high healthcare premiums. As Obama has said, we cannot pay for this much-needed reform on the backs of the middle class.
In order to save families and small businesses from bankruptcy, we need Congressman Murphy and his colleagues in the House to pass H.R. 3200 this week before they go on recess. In order to save lives, this bill needs to be passed now. For every day it languishes in the House, the true reform this bill represents gets watered down. For every day America is forced to wait for quality, affordable health insurance, that realization grows further out of sight. We understand the concerns of Congressman Murphy and appreciate his commitment to the public option and sustainable reform that a plan that this bill must represent true reform and not more of the same hidden behind the label of reform. This bill must be passed now in its original form and it's fulfilling its true intention. quality, affordable health care for all.